Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems Better Care podcast. I'm here today with Dr. Fadul. He is a Harvard-trained, board-certified physician and CEO of BeSpoke Concierge MD, where he is specializing in personalized concierge and functional medicine. Thank you for joining us today.
Thanks for having me, John. It's a pleasure to be here.
Yeah, thank you for your time. Really appreciate it. And just to give our listeners like the backstory, like how did you get here and like what are you building right now?
Yeah, so Bespoke Concierge MD, we focus on core primary care services with all the best validated tools of functional medicine. A lot of times I see people really excited about the functional medicine space, and there's a lot of great things happening, but some of them are just, it's all talk, where some of them are really strongly validated. It needs to be integrated properly into a good PCP medical model to get the most bang for the buck.
What solutions specifically are you known for? Like, why do people reach out to you to work with you?
A lot of people, maybe they like their doc, but the issue is access, right? And so if you want to get seen, it takes months to get into seeing a point to get a provider, or you go to an urgent care and then you get really fractured care. You're getting a script for a pink eye, but it's not with somebody who knows you, and then that person isn't talking to your regular doctor because the system's not really set up for that. So we are trying to solve a couple problems, validating the best care, giving people access and continuity. So we think that's the right approach to medicine.
And what does it look like when like a new patient, potentially new person comes to you, says, "Hey, I'm looking into becoming one of your patients." What does that intake process looks like when you bring them on?
Yeah, so they just do a basic H&P. For any of our patients that come on, they have a chance to kind of test out the practice, meet one of our 9 providers at this point. And so they'll do a history, they'll go through symptoms, we'll order biomarkers, and then we do goal setting, right? It's important to get a sense of what patients want to work on. Some patients come to us and they really care about longevity, and some people just want to focus on how they feel today, right now. We call that health span focused. And some people just haven't been to a doctor in 20 years, and they want to make sure that they're doing their preventive care and that they're doing the things that matter, and that's their main focus.
What are some of the misconceptions that people like patients come in with, like when they first see you? I'm interested to see like what they say, and curious about that.
Patients sometimes think that concierge services are expensive. They don't have to be. So we have a direct primary care model. It's very affordable. Sometimes patients think that they're immediately going to be sent off for $1 million workup, which is not necessary. And sometimes patients think that they're not in control. And, they're always surprised when you're talking to them about setting goals and working on an algorithm that suits kind of their needs. It's akin to going to your dentist and the dentist says, "Are you happy with your smile or not?" If you say you're not and you don't have a toothache, guess what you're going to work on next? You're going to work on that smile. And so a lot of patients don't realize they have that ability to just say, "Hey doc, I want to work on weight loss." Or I really want to work on my sleep. I'm not getting good sleep. They're not always expecting you to give them a pill, but they want to talk to somebody and help with that lifestyle habit improvement and medication support and things like that.
And where do you find yourself kind of spending the most energy today? Because I know I speak to several concierge medicine physicians and they have different focuses. Sometimes do a lot of research or seminars or networking with people. Curious, what does your day-to-day look like?
About half my day is on patient care, and the other half is on either outreach or engagement on the B2B side. We've launched a few months ago, we launched our business-to-business platform. So we brought that concierge model to companies as a whole. And so a lot of times what I do is talking to CEOs or talking to other thought leaders and trying to build systems for their companies. Because we really believe in democratizing access to high quality care, and not just for people who know where to look. So if you're working at a company that needs healthcare access, by all means, give us a call. We've got a solution for you.
What are those leaders like? How does that discussion or what does it look like, I guess, when you engage with them?
Typically for businesses that I talk to, their whole focus is on cost containment. They also worry about retaining their top talent. So what ends up happening is it's very attractive to offer a free membership to a concierge medical group. Because in the end, we're licensed in all 50 states. We take care of people everywhere. And so when you have access to that, all of a sudden your whole family can be seen by the same doctor. And it doesn't matter if they go on vacation. Not only that, but they're not getting nickel and dime to death with office visit fees. And so for employers, they're attracting and retaining top talent. And they're also guaranteeing a certain level of cost for their businesses, which is hugely attractive. On top of the fact that you have immediate access within a day or two in just about every case.
Would your model be described as like a direct patient care model where you pay like a membership fee? Is that basically how you're structured today?
Yeah, we have 2 sides of the house. We have a direct primary care model and we have our high-end concierge services. And we have little carve-outs in between. For businesses that want to do it, it's the same thing. We just do a direct employer health model and then concierge services for anybody who wants to pay for that upgrade. But yeah, it's a pretty straightforward model. Patients are choosing their providers providers have a handful of things that we want everybody focused on, whether it's sleep or preventive care, sexual health, chronic disease management, all the things that we think go into, all the pieces that make up your healthcare picture.
What have you noticed like over time too, now that you've been working in this concierge space, is like, are there specific complaints that seem to be cropping up more than when you first started? Like what have been the trends working with your patients?
Typically, these patients are motivated by TikTok trends or other things they're seeing on social media. And they come to me with one of two ideas. Either they're a biohacker and they're convinced that they're going to live forever, or that they want to try, which is totally fine, but they want support, which we're happy to provide. Or they're people that are skeptical of everything they're seeing on TikTok, and they're turning to us because, we're in the news a lot and we work really hard. We got lots of credentials throughout all our staff, and they want to know that if they're going to put effort in and time in, that they're not going to be spinning their wheels. And so we get a lot of patients who have an appetite to invest in their health. And like in the end, they just want to spend more time with their families, and they want to spend less time trying to navigate the healthcare system.
To figure it out. Yeah, that makes sense. And do you mind kind of expanding more on the biohacking? I know that's a term used like especially in social media all over the place. Do you mind kind of simplifying it for us in a way that we can digest more easily?
Biohacking is where you focus on things that are going to net improve longevity. So I'll give you an example. People are obsessed with peptides these days. So as an example, NAD plus and sermorelin and BPC 157, so forth, so on. If you're taking these peptides and you're trying to squeeze out every ounce of optimization out of your body, that's biohacking. And so you're doing everything you can. Sleep maxing is a form of biohacking. So people are, becoming, and appropriately so, and obsessed with their sleep patterns and seeing how consistently and how much they can improve their quality of sleep. And so that's a form of biohacking. It's not as popular because it's free, but if you're literally getting grounding mats and you're taking magnesium right before bed and you're doing all these little things to just squeeze out every bit of optimization out of your sleep, that's biohacking. So if you're looking at Brian Johnson, I think is one of the most famous biohackers, and he does, he's taken 60 supplements a day, a
Wow.
whole slew
Yeah.
of other things. The guy, he has a $2 million a year regimen, which is insane. I mean, it's literally on the far, far end but he's a biohacker. So hopefully that kind of breaks it down. The core issue for most people is, okay, what's the best return on my investment of time and money into biohacking? So for me, I enjoy cigars. That's not really optimal for my health, but it led me into being an anti-inflammatory nut, right? Because I'm looking for ways to offset my one vice that I love. I don't get to do it often, but when I do it, I feel the inflammation built up. And so I work really, really hard to be on an anti-inflammatory kick. And so I know that when I do certain things like tart cherry juice or good sleep or consistent exercise, I'm bringing down my inflammation levels. And it gives me a little room to afford my occasional cigar habit. So
Well, thank you for enlightening us. I really appreciated that. And like just looking at like the industry as well, like every industry's got its blind spots. Like what's one shift or trend you see happening right now that most leaders are ignoring or not really paying enough attention to?
if I tell you that, I'm giving all my competition a heads up. So I don't know if
Give us a glimpse, just a little.
I'm having fun with you. In the last year, there has been a big realization that if you're really going to do a good job as a biohacker, and if you're really going to do a good job in this longevity medicine space, you have to have a doctor who understands real medicine. You can't be chasing trends. And so you're seeing it actually, even with Brian Johnson's Don't Die and with several other programs, they're struggling because they're selling a bunch of fancy, expensive testing or a fancy, expensive procedures that don't actually work if you don't have it tied into a really, really thoughtful longevity program. So concierge doctors are doing great because we look at everything. We look at your sleep, we look at your diet, we look at hopefully your blood pressure and all the biometrics. And we're not just trying to push, one expensive test after another. It doesn't actually do much of anything. Imagine if you are investing in a really, really expensive 8-cylinder engine that you think is the greatest thing ever, but you don't have a car. What's the point? And that's a lot of times that's what ends up happening with precision medicine testing. People are getting DNA tested, but if nobody ever integrates those results into your lifestyle pattern, what difference does it make if you got your DNA tested? So
Yeah, that's a good insight too. Is like you get all these tests done, but like how are you going to overlay it? You don't want to change your entire life. In most cases, you just want to make it work for what you're doing right now.
right,
That's the most.
yeah,
So
yeah, it's exactly right. It's exactly right. So
yeah, and when you look at, for example, things are going really well, things you'd never want to lose. What's one thing going on right now that you would just hate to lose as far as what's working great?
that's hard to say, man. So One thing I wouldn't want to lose. If you're talking business wise, I've really, really enjoyed all the studies that have been coming out. And I know there's been a de emphasis on research and development this past year with the government. That would gut me if if we really stopped with all the great research that's been coming out the last 5 or 7 years. That would really gut me if we lost that. In the end, I'm relying on that to then turn around and put effort into my patients, right? The lithium study that just came out for Alzheimer's is a great example. 5 or 6 weeks ago. It's fantastic, right? These updates are so helpful. Regular doctors are not going out and funding $3 million studies on this stuff. We don't have access to 1 million patients to run through a database. So if the government stops leading the charge on those things, it really hamstrings what I can do. It takes the average, I think I read this once, that for 50% of doctors to incorporate the most recent evidence, it takes an average of 7 years. Just for 50% of us, right? So yeah, so so there's research that's constantly coming out, and I'm working my tail off to stay relevant and current on it. And I know everybody in my group does the same. So if we stop getting a good pipeline of this research, it will slow down what we can do in turn with our patients, right? So the DNA testing is probably the best example. That is so common and so widespread now. It started with George H.W. Bush, I think, in the 90s, being the first person that they did the DNA testing on, or I think he pushed us to launch this project. And I don't know, it was something like $1 million or some ridiculous number to get his one DNA sample done. Now testing's like $300 or $400 and everybody can do it. And so it's amazing. And now they've taken it a step further by taking AI and incorporating every time there's a new discovery, they're now incorporating that into your DNA genetic code to find out if you have these genes that will predispose you to some other illness. Like that's all done in the last 30 years. It's phenomenal, right? And so if we stop investing in that, it's really a shame. So I don't want to see that go away.
And curious too, for when you're doing research or you're referencing like standards and especially concierge medicine, are there organizations out there that people should know about or reference, like if they're trying to biohack or research on their own and just learn more? Curious about that.
Probably the single organization that's making an effort is A4M. It's the anti-aging group. A4M.com, I think, is their web address. They do a pretty decent job of kind of pooling all these together. They have lots of certifications. Is it 100% perfect? No, no organization is, but they do a pretty decent job of bringing everybody together. There's a European equivalent whose name I don't know off the top of my head. For me personally, I look at source studies for everybody all the time. So the CDC puts stuff out, FDA puts stuff out, the British Medical Journal like different groups are constantly putting research out. And so I'm making an effort to stay, ahead of the curve, just like most of the docs in my group are. So it's hard to recreate that with any one organization, but A4M does a decent job of strictly biohacking focused efforts. Aside from that, there's, just like yours, there's great podcasts out there that are solely focused on this. They bring really thoughtful people. Huberman is one that I think a lot of people are familiar with. So I encourage people to get a variety of sources. And really the key is, are they having an appetite to improve themselves or not? Right. And then whatever the source they're getting, just verify who you're talking to or why.
Yeah, that's instrumental, especially when they're making a decision, right? So, and looking at like the opposite end of the spectrum as you're working with your patients, well, it's been kind of harder to work through like in your business than you expected. Curious to get your perspective there as well.
I think sometimes patients come to us. We work really hard to remove friction out of the healthcare experience. For example, our team is the one that calls the insurance carriers and validates who I can send for specialists and getting blood work done. But you still have to have an appetite to do something on your own. And so for our patients that, we can we'll have phlebotomists come to your house, but you got to be available. You got to give us a schedule. You know what I mean? We can't do it for you where you have zero participation. We can get it down to like 5% participation, but we can't get it to zero. So it surprised me people are willing to pay money for concierge memberships and then not really aggressively take advantage of it. We want to see everybody get better. We want them to feel like a really good return for that investment, both of time and money. And so that's always a little bit of a surprise when people pay a lot of money and they just kind of like, I'll get around to this. Like, what?
Yeah. You want to see that engagement as throughout the process. What are things like you've tried too, or things that have been successful in engaging those people, or curious on that as well?
Yeah, so I'm embarrassed to admit this, but I started a YouTube channel about 4 months ago. We talked about this.
Yeah, I remember you talking about that. Yeah.
Yeah, that came from the patients who, I can say the same message, but sometimes they want to hear it at 3 a.m. and sometimes they want to hear it on the appointment. And so we've been doing it. I've encouraged the other docs, so the other docs are going to start doing it soon too. So that has been, I think, the single biggest difference maker. The patients have encouraged me. We've done this now. We've built out a nice app that engages the patients and puts them on a pathway that they can, kind of work their way through this problem set or that problem set, and integrated the YouTube videos actually. So they have the education they want when they need it. And so that's been It's been a learning experience for me in the past year. And so the patients have been very gracious at telling us what they need or want. And it's made it very, it's made it much more value add for them when we know.
And where do you guys want to go, like in the next 6 to 12 months? Like, what's the vision?
I'm going to follow Elon Musk to Mars. I'm just teasing. Yeah, no, I'm just teasing. No, in terms of the next 6 to 12 months, we're really aggressively focused on our business to business outreach. And of course, we're always happy to have more consumers just come to us directly, but our focus has been integrating aggressively on the B2B side. We found that employers are really grateful when the employees get good healthcare and they have access and they're feeling great. They're doing a lot better work at work. And so we're happy to be in that space, and we've had a lot of success early so far. We're just taking that model that we've refined with consumers and broadcasting it to the business community. The value is the patients don't have to pay for it directly, and they're just getting spoiled by the attention we're trying to throw at them. And the employers love it because their people are being taken care of, and they're getting a lot of value for their employers or their employees in a sense of retaining that talent. That's a big deal, right? Like you want your employees to feel like they're in that sphere of trust and in that sphere of support from the company. So we're one of the ways that people do that.
Is there a particular size, like say that you have one of your prospective clients now watching, is there a particular like size business you work with, or like what's optimal size, just so people have an idea?
We have companies as small as 10 employees,
Okay.
and those are easy, right?
Yeah.
The sweet spot is when a business is growing and they're in that 75 to 155 employee range, because we can set up a nurse clinic on site, and we can start to build out those services and grow with the company. Now we could take on our biggest client, we can take on 1,000-person company, no problem. But we want to grow with the companies. We want to support their healthcare from the get-go, integrating our wellness programs, integrating our primary care, integrating an on-site clinic. We found that those things really help. And then if you're growing and you have that kind of support, you're retaining better talent. It's the culture is there from the get-go. That wellness culture we try and instill in people is there from the get-go. And so as the company grows to 1,000 people, everybody's used to these programs that we have. Everybody's used to the monthly newsletters. Everybody's used to the wellness challenges that we implement. And it congeals really nicely.
Yeah, that's excellent. And now that we're getting toward the end of the podcast, like, where can people find you, connect with you, learn more? I know your YouTube channel is blowing up right now, so you're doing amazing.
Yeah. Sometimes for the better, sometimes not. We get some mean girl comments lately, which is kind of funny. But yeah, they're welcome to come to BeSpokeConciergeMD.com. Everybody's welcome. They can send a message directly to me, Dr. Fadul, at BeSpokeConciergeMD.com. But yeah, they could check out the YouTube channel. I'm on LinkedIn. Most of the doctors are as well. So we welcome all comers.
Well, thank you so much for your time. It was very insightful, and I learned a lot today.
Thanks for having me, John.
Thank you.